Do you have a bunion? Are you worried that your only option is going to be surgery? Make sure you watch this video. I'm going to take you through the number one mistake that I see people think when they have a bunion. And in fact, I have successfully treated bunions for over 20 years. In fact, we have over 150 people with a bunion come through our clinic every week. I'm going to share that knowledge with you today so we can help you avoid the need for surgical intervention for your bunion. So my name is Daniel Fitzpatrick from Sydney Foot Solutions. We see lots of bunions, in fact, over 100 a week, about 150 a week. So the reality is that most people with a bunion, firstly, don't realise that they can do something about it conservatively. And if you'd like more information, make sure you check out our website at sydneyfootsolutions.com.au. But the number one mistake that I see with bunions, and if people are having bunion pain in particular, is that they often wear their runners too tight. And the reality is that if your runners are too tight, they will put pressure through the bunion area and increase the development of your bunion and increase the bony uptake. In fact, there was a really interesting research paper done in Scotland where they compared the pressure because of tight runners to stiletto heels. And they actually found that tight runners cause more pressure through the bunion area than a stiletto heel in some cases. So really something to be aware of. So just a bit of a top tip, if you do have runners and you think they're a little bit on the tight side, it's really simple, just take the inner sole out. This is just window dressing. When you talk to the shoe companies, they will talk about how this is just window dressing and that you can help to alleviate it. Most of the cushioning, if you're worried about cushioning, which this isn't offering a great deal anyway, but what this will do is most of the cushioning is in this area here, so you don't really need this piece of material. It's not super relevant to your needs anyway. You won't lose any support. I know it feels like it's supporting your arch, but it's not. Most of the support in a runner is through this area here and this area here. And so what I would say is the key is to make sure your runners or your flats or your casual white shoes aren't too tight. The great thing is you can keep wearing heels, you can keep wearing feminine shoes. I'm not saying heels don't cause any problems, but believe it or not, they're not the great evil that we think they are. In fact, most of our patients don't wear their heels that much for them to make too much of a difference anyway. If you do wear heels a lot, I definitely get some professional advice so you can avoid the problems that are associated with heels. But the great news is there's a lot you can do for a bunion from conservative management approach. The reason I made this video is that comes up all the time at our clinics. And in fact, people can't get over the level of relief they get when they take the inner sole out or they buy bigger shoes or wider shoes. But it doesn't mean you need to give up the shoes you love. You can still wear a variety of footwear, you can still be active, and in most cases you can avoid the need for surgery. So the reality is that at the moment, if you would like some individual advice for your bunion, we have a 60% off initial bunion assessment. Make sure you check it out. A really great offer. The reason we do that is so people can get professional advice specific to their bunion. If you do come in for your assessment, make sure you bring your shoes in so we can have a look at them and help you out with that. You might say, how do you treat bunions and help to avoid surgery? The reality is that what we're doing is we work on correcting the underlying cause of why you got a bunion. So the reality is that when you get a bunion, it's usually because of a level of misalignment through here. This is what you inherit, and that leads to compensation up here. And as a result, because of the way you stand, the way you walk, over a period of time, that causes a bunion. Thankfully, no one comes out of the womb and has a bunion. You usually get your adult foot at the age of 7, and then you develop a bunion from there on in. So the good news is there's lots you can do to help with a bunion. There's lots you can do to get on top of a bunion. The sooner we treat it, the better the long-term outcome we find. As with all conservative management approaches, if you would like to avoid bunion surgery, then I suggest you check out our 60% off initial bunion assessment. Go to our website at sydneyfootsolutions.com.au or just click on the link below and you can claim that offer and get professional advice so you can avoid surgery for your bunion.